Hey guys, happy Friday! This is Blake from the Association for Vascular Access, and joining with me today, Swapna Kakani. So, welcome, Swapna.
Thank you, Blake. I'm glad to be here.
Yeah, well, we're really excited to have you here. As we continue our speaker showcase, basically highlighting our speakers that are going to be presenting at a conference, we're really excited about AVA Scientific Meeting 2022 in Minneapolis. So, if you haven't registered, you can check out the full list of speakers, register for the event. Link is down in the description for this video. So, Swapna, tell our audience a little bit about yourself. If I didn't know who Swapna was, what do you do? How are you engaged in our vascular access family?
Yeah. So I have a long history in vascular access because I was born with short bowel syndrome 32 years ago and have needed TPN or IV fluids and enteral nutrition since I was born. So I've been on TPN for 29 years and have had multiple central lines, unfortunately multiple central line infections, and have experienced healthcare from multiple avenues at different hospitals, different home infusion care entities, and from that experience have really seen the need and appreciated the value of the patient voice being at the center. But we have a long way to go to make that uh, more valuable or more centered patient centered care in vascular access from my experience. So I have become an advocate in vascular access as well as in my specific disease state, short bowel syndrome, and the larger rare disease population in the last couple years, leading me to becoming a board member for AVA, which has been an honor to serve on the board for the last 2 years. My tenure will come to an end at the end of the year. And I have loved public health and looking at problems from the top down. And so I got a master's in public health and healthcare organization and policy, and also I'm involved in advocacy from the policy side as well, and looking forward to getting involved in that space as well as it relates to AVA, and
Yeah.
have in the past.
And we've gotten an opportunity to work together closely with the Beyond Acute Care Special Interest Group with the Association for Vascular Access. So you've been a huge partner in that, a great patient perspective voice in our group. So wanted to thank you for your service in that role as well. I love it because some of my interest groups or interests in groups in healthcare or with our association or in vascular access has been how do we help educate patients? How do we improve the transition from hospital to home? How do we improve keeping care close to home? Because, families help patients heal, and being home is a really important part of that when it's appropriate. And how do we give people the tools for success so that they can help manage themselves and know what to ask for when it comes to their caregivers, whether that's their family or the professionals that are coming in with supplies or education or training. So thank you. Yeah, no, it's been great working with you.
You
So
too. I'm very impressed and excited to stay involved in VACSIG.
yeah. So you're speaking at our conference. So as we do with these speaker showcase highlights, is really try to give our audience a little bit of a teaser about what you're going to be talking about at conference. So what should we expect to hear from Swapna?
Yeah. So having been on TPN and needing IV fluids for essentially my entire life and having needed central access my entire life, I'll be talking about valuing the patient perspective in both preservation of vascular access as well as protection of vascular access in terms of safety, keeping the line clean, safe, and secure, but also in the preservation of veins and making sure we can sustain with the veins that we do have for the need of therapy. And so, I've kind of gone through all aspects of disease management, and unfortunately also vascular access complications over my lifetime. So I'm going to be talking a little bit about my story so people will understand where I'm coming from the general story as well as specifically the vascular access story, and then discussing how to prioritize the patient perspective when it comes to discussing preservation as well as protecting vascular access, and really how to have those conversations and what to talk about and how to empower the patient to get them to also express what their priorities are, to talk about how the patient, we are more than patient beyond our label of as actual, right? And we're more than just what we're titled in the hospital, and we can provide a lot of different types of, I put data in quotation marks, for both in the home setting as well as in the hospital setting, that can value the clinical team, that be that the IV team, PIC team, your IR team. What I always say is be the champion at every access point. And so how do you do that both by empowering the clinician as well as empowering the patient? And then I'll explain some positive partnerships and some partnerships that have gone array, but what we've learned from that.
I think that's
That's
awesome.
a little bit of the nutshell.
Well, if you guys have had an opportunity to read Intervascular Quarterly, so new issues coming out, one of our previous issues, I believe Eric, our new chair, well, our chair elect and our chair next year, Eric Samerpan, had talked about a patient education story, and the patient had a young man had pointed out to one of the physicians about scrubbing the hub and how important that message is, and how important for self-care and self-advocacy that is for patients to understand what's right and wrong, even if they don't feel comfortable doing it themselves. They can understand when there's some breach in the normal operating procedure for making sure that their device, their lifeline, stays free from infection. So, and you've certainly, I think during our time together, you did have a central line infection at some point.
Yes.
Yes.
So, I
And
mean,
so
I could give a talk
yeah,
just
all
on
the
this last year of life, which
yeah,
a little bit of the talk is on that,
yeah.
because I have gone through the ringer in this last year, unfortunately.
You made all
But
the calls though.
I'm not gonna give the details because you have to come and listen to the talk to know
Yes.
exactly what has
Yes.
happened. But I have come out through the other side. But I've learned a lot in this process. And one of those things is creating plans before you need it, before
Yeah.
you need them in vascular access. And I think we undervalue the value of communication of
Yeah.
of some of these simple things that we kind of talk about. It's just talk, it's fluff, but that is so valuable to the person receiving the care at the end of the day.
Yeah. Well, Swapna, I want to thank you for coming on the call today and introducing your presentation yourself to the all the world in Facebook and YouTube when they get a chance to look at this there. So I'll take us out. And well, guys, thanks for tuning in again. Happy Friday, Swapna. Thanks again for joining us today for the speaker showcase. And
Thank you.
Yeah,
Thank you.
happy to have you. So with that, guys, follow the Association for Vascular Access. You can check us here on Facebook Live, typically every Friday around noon Eastern Standard Time. You can also check us out on YouTube. So if you're not watching these here, you can check out all of our old postings there on the YouTube channel as well. You can also follow us on social media. That's Facebook, Instagram, LinkedIn, and Twitter. And of course, we'll catch you on the next one. So till then, have a great
See
weekend.
you at the meeting.
See you at conference.